Good afternoon, everybody, and welcome to our next wonderful pedagogical session. This one, it's my pleasure to introduce my dear colleagues Hannu and Jarno to talk about simulated pedagogy for paramedic education. Their session today will be interactive, and it will be a bite-sized taster of a real live class condensed into an hour for your pleasure. So, without further ado, welcome. Yes.
Hello, everyone. I'm Hannu Salonen from Kotka, from Finland, and basically I'm graduated a firefighter, and then I'm a paramedic nurse, and then a leadership course, and about 10 years ago I graduated in Eastern Finland University. And I've been teaching paramedic students and also firefighters. I've been teaching about 20 years. And using this simulation method about 15 years. And what is the main point? I think about 50 years ago that I was a good teacher. And I was rewarded with a year teacher in 2007. I think about that I was a good teacher. But 50 years ago, I went to the simulation instructor course in Denmark. And there I realized that I have to change my teaching method. I have to change because that course takes my pedagogical heart. And after that, I've been teaching this kind of things like human factors and how the people and how students, how participants, how they really learn. And that's why I'm here. And I'm glad that I can be here. My dearest colleague, a lovely colleague, Jarno. You can introduce yourself.
Yes, thank you. Thank you, Hannu, also a good friend, not more than a colleague also. Well, I'm Jarno Hämäläinen. I'm also lecturer, but I'm also head of our degree program. And so, because I'm a head of our degree program, I take my time now. I will tell you a story about my first name. Because there's some connection in Italy. Jarno name, my first name Jarno is purely Finnish name, but someone could remember ex-Formula 1 driver Jarno Trulli. He was Italian, still is Italian. Okay, I didn't know that. Thanks. Why there are Jarno named persons in Italy? There was Finnish road race driver Jarno Baron Saarinen, and he died in Imola at 1973. So in the mid 70s and late 70s, Italian personnel who were parents who were motorsport enthusiastic, so they keep their son's name Jarno. That's small story.
Okay.
Did you do that? Okay. I'm well, some words about my background. I'm paramedic. Well, exactly, I'm nurse paramedic because in Finland, our paramedics are graduated as a paramedic, but are registered as a nurse. And after that, I have been completed master degree. Program was healthcare development and management. In the field, I have been working about 15 years, and I have been lecturer about 7 years. Yes, that's my background and story.
Maybe we will back it finish program how we teaching and how long is the 4 years takes they graduate to paramedics. Next slide.
You want to use the clicker? Yeah, there you go.
Okay, there you will see how the simulation pedagogic method usually goes. There's the introductions, there's the simulation scenario, and the briefing session. And now in this 1 hour, like Kai already told, that we use that method in this whole 1 hour. And you are my audience. You are participating in this simulation also, and I have a person in here, and I have all paramedics here, and they will show how simulation goes. But it starts about 20 minutes. We discuss how we use that and why. Couple of things over there. There is. Yeah. What is simulation method? I'm sorry. Why is important to set the learning goals? Because that is the main point. What I about 50 years ago I really noticed that I had to know what the participants know before they came to the simulation scenario. I have to really know what they know. And also, why is the center role is a debriefing session. In Finnish, we could use the name oppimiskeskustelu. It's a learning session, learning conversation or learning discussion. But in science, if you find exams or science, there's a debriefing. We think that is a little bit harhaanjohtava sana. It's a little bit. Yeah. Okay. Those are key points in this session, and there you will also see what is the key point in the whole situation when we teach the paramedics. We have to take care that they know the human factor, what is always with us when you go to the home and do dishwashing or something. It's always human factor thing. And what we really want to know, we wanted to, that they are motivated when they are coming our lessons. They are smiling. Now everyone, I hope that you are smiling right now. You also. It doesn't enough. Okay. Because I smiling, you smiling, everybody smiling. We have a quite funny when we take these kind of learning sessions. And that's true. Because we think about it, it's important and people feel like comfortable. They are smiling. And before that, quite hard situation like heart attack or CPR situation or something like that. When we discuss after those kind of situations, we wanted that they are still laughing and because this is the learning process. That's why we have to take care that we achieve the flow mode. Very, very important. And very basic words and letters is it's a XAP, K, S, A, and B, knowledge, skills, attitude, and behavior. And I think you are the professional teachers, and you also wanted that everyone has the knowledge and skills. But when you teaching the simulation method, the knowledge and skills have to have that. And they come our sessions, our simulations, when they have the knowledge and skills. And then we practice the human factor things and maybe attitude and behavior. Because now you are sitting over there in a backyard. I don't know what is your name. Yeah, and yeah, that's okay. But now I really don't know how you act or how you behave, and I don't see that. But a couple of questions, or you take exams or something like that. I know your maybe your knowledge and maybe skills also. But simulation method, we can show how people react, how they act, or how they communicate, how they make teamwork and something those mainly points. Like those Diekman and Kolb, you already read Kolb circle of learning process. It's pretty much same, because we don't use the simulation method in a lower degree in a children's or elementary school or something like that. When we use the simulation method, they all participate. They are adults. That's why they always have experience when they come in our simulation. And today, Antti and Veera, when they come our simulation things, I know that they are adults, yeah, but they also have those knowledge and skills how they handle this paramedic situation. Today we have a chest pain patients, like a heart attack today. Okay. Then couple of words, fundamental way how we get to students to familiar why we using the simulation how when we wanted that they learn the human factors, because human factors are essential. We are healthcare people. We also teach nurses and higher education program, managed program, but they all are healthcare people. What we are teaching, Jarno and I. That's why we have to learn other industries. CRM, crisis resource management, crew resource management, team resource management, bridge resource management. It's a funny, it's more than 3 or 4 names what you can call, but crisis resource management is the basically what the safety critical industries use, like aviation, nuclear industry, railway industry. Those use the simulation method when they teach the human factors and safety systems. Aviation starts to using simulation and human factor. Someone might know that 1977 Tenerife, 583 people died because I, Captain Jarno, co-pilot, and I decided that this field is empty, and now we are going to go over there in this plane, and the other plane came and there crashed, and 583 people died in that accident, 77 in Tenerife. Then they think about it, that why that happened and what we have to change. We have to change that. We have to understand human factors. Why Hannu told that this Hannu's situation awareness told that is it empty? We are not thinking about it. Not empty. Hannu is the captain, and the captain decides. Then they notice that good, se ei voi olla sellainen.
It can't be.
It can't be that kind of process that only captain tells. It's pretty much the same in healthcare field. We have doctors and we have nurses, and the doctor says it's like nurses come back and do it today. It's not a safety system. They have to communicate. They have to make
decision together.
Yeah,
Yes.
that's okay. And another is ANTS method. 18 is Aberdeen University, and they noticed that human factor is depends what people how they handle in critical situation when anesthesiology, like intubate the patients or something like that, and they found that human factor is about 80% in the
when the mistakes happen,
mistakes, and
80% the reason was human factor.
Human factor, and they have to change the education system also, and this is the I have a slide in here. These non-technical skills, we take the A away because you can use it another field also than anesthesiology. That's why it's a non-technical skills, and teamwork, decision-making process, task management, and situation awareness. Those exactly those 3 points. Also communication and management. NASA take the search and found that aviation and NASA projects, they noticed that 85% is the harm or close situation with the harm. It's caused that this process and these kind of things make lack down, not knowledge and skills. That's why we teach the knowledge and skills different way, no simulation way. But when our paramedics Antti and Veera goes over there, and I know that they know, they are comfortable, and then they come here and treat the patients and make everything very good. And we only, Jarno and I, instructors, we only take a pace and
it went very well.
It went very well. And then we discuss, because our learning goals are not knowledge and skills, never. Why is it? Because they already know. We training these kind of things. Our learning goals is this four things. Today is the situation awareness.
Nopeutta.
Okay, this is very funny. This is 2 different ways you can think about it. This is a finished motorway, and when the driver noticed that traffic signs over there, he noticed that he had to slow down and about 50 kilometers in hours. It's a limit.
Yeah. Speed limit is 50 after you pass that sign.
And a couple of years ago, I teaching simulation method with liikenneopettajille. Traffic instructors who teaching those signs, and I showed them this. What is the right sign? We notice that this is the right, but they don't see that. They only see that 6, and 2 of 20 notice that this is the right, and 18 I don't really know. That's why I use it in here. Did someone recognize why why I showed it? This. You learn. We are in here, and you are teachers, and maybe best practice in your colleagues and things like that. Why I saw this picture? That is now is Nina's moment. Nina is our. Now I say a little bit funny, but I say in Finnish. Ammatillisen koulutuksen tärkein tehtävä on tuottaa sinne työssä vaadittava sisäinen malli. Internal model. If I put it this, thanks Nina.
Yeah.
If I put it this signs and place over there, what do you think about driver do when he driving 100 an hour? Yes, exactly. Your internal model is that you have to do what these signs. How big difference has to be that you changed your model? What kind of sign? If you put it your Hopei HP laptop in over there, that's really different. But what kind of great difference has to be that you change the model? Color. We think about it's exactly the same. Maybe. I think, or we think that we have to teaching that model, not in specific for this or how you take this or this is skill station and knowledge. But when you are working in safety critical industries, we think about it that healthcare system should be that kind of. We teach in context. Antti and Veera, they are really now working also in the field, and they are really paramedics. They introduce themselves when they come in here, but they also they handle every situation what people you call in 911 or what is the number we have a 112 and maybe it's Europe is 112, but they handle every situation because they know the context. What is important in this context, and that is what we teach. This is the simulation basically made of phase 1. We are right now phase 1. We are prepared for the simulation. Then you will see next the simulation scenario, and then you will see how we use the debriefing session. And there's mainly points, quality skills and attitude and behavior. And our learning goals, we already said that. It's the human factor things, crisis resource management or non-technical skills. And what we try to do, we try to create flow and remember smile. One smile and a couple of smiles over there. Now everyone's smiling. Yeah. Okay, now our paramedics, you can come here. Our patient, you can also come here. And they will introduce themselves and then we start. No. Yeah.
So you know me, I'm Kai, but in this situation I am Kai, but 20 years older. I'm in my mid-50s and I'm having some pain.
Hi, my name is Veera Kamoja. I'm a paramedic and I'm currently doing my master's degree in healthcare in XAMK.
Hello, my name is Antti Jakonen. I'm a colleague of Jarno and Hannu. Actually, I'm also have been Hannu's student from the beginning of my bachelor's degree, which I did in XAMK. I also did my master's degree in XAMK, and Hannu teaches me there also. And since the XAMK doesn't have a doctoral program, I'm doing my PhD in University of Helsinki in the Faculty of Medicine in a doctoral program of population health. And my thesis is about this context that Hannu mentioned and is showing to you. Yeah, and also I work as a paramedic.
What is the most important? A couple of nights ago, Antti told that, Hannu, you could be my father. That's a very good. Okay, now, before the simulation starts, I have to know what they know. I have to know that they can handle this situation. They have been skill station. We've been training together. I've been next to me and show how things goes. There have been studies, there have been learning, there have been lessons, teams, every other pedagogical ways. And I know that they could handle that. I have to know, because if you doesn't know, you don't use the simulation method. Now you remember that, it's the main point.
Yeah.
Yes. Hyvä. Okay, now Antti, pitäisi kuulua hälytysääni. Alarm.
This always freaks me out.
Paramedic.
Get the mission.
Okei, mä tulen sanomaan teille sitten. Saat menee tosta sitten, kun tuutte sisään. Annetaan ne valmisteet. Odotatte siellä sitten. No.
I'm not a paid actor.
This is a funny. Yeah, no. This is a funny situation. Now paramedics, they are. It's really happening in our college. We put in paramedics over there. They have equipments over there. They are preparing. They are okay. Now then I go to over there and okay. Now you are ready. They already get the alarm. Their signs our number 704 with the chest pain, and they are signed. Okay, chest pain. They have the checklist and make some preparing, and if we have take this time too long, they paine kasvaa.
Then the pressure grows.
The pressure. They are whispering and what the hell is happening over there? And I go, okay, we have some technical problems. Our cameras doesn't work or something like that. And I come down then and then they succeeded. Now you are my audience. Now you have to imagine yourself a few seconds. You are paramedic students, and you are paramedic students right now. You also. You. Okay, and your mission is follow that how they, what kind of situation awareness they have. What is your opinion when we conversate after the simulation? I will ask you this part. And this part, you have to think about what kind of teamwork they do. There's only pair work, but teamwork, we use it teamwork. Okay. And we already take the pictures in our school and our colleagues, and this is our colleague Jussi. Jussi has a chest pain. Here is Jussi or Kai. He's a multiple person, yeah. And simulation starts when paramedics arrive. Do we have to take the paramedics also those?
Do I give this one to them, or which one is easier? I give it this. Okay.
Okay, it's okay. Ja toisesta ovesta.
Yes. Valmiita. Tulkaa tuolta ovesta. Mä annan teille tämän mikrofonin.
Here is Aki, because Veera doesn't take part in this teacher session. Paramedics came in, and Aki is not Aki, it's Veera. Yoo-hoo, Veera.
Yeah. Better choice.
Hi, what is the emergency here?
I have some chest pain and my arm is falling asleep.
Okay, let us see what is wrong with you. Okay, so the airway is open. He's breathing quite regularly, and I can feel the radialis, and the skin is dry and warm. So we can proceed. Okay.
Okay.
Right.
And now you can stop. They have equipments. They have a couple of bags and defibrillator monitor and defibrillation systems. And then they if this first session, it doesn't what kind of pains you have, or you are a patient right now, or they always do everything exactly the same way, like the safety critical industries. They always make the same way. If we have a problem in this session, we take the another, and now I really know that they, and you also notice that they handle that. Okay, if it's okay, they continue. And let's see what happened. There you are, secondary assessment.
Okay, so would you do the ECG now, his experience in chest pain? Okay, so let's proceed.
They proceed that they prioritize important examination. If you have you have to take a few seconds. If you have a chest pain, they prioritize the ECG. Or if you have unconscious, they prioritize that kind of situation. What treatments or examinations? What like a blood sugar or something? What we can pretty much. Short time to fix it. Now they take the ECG, and they together they will get the teamwork. They will use the checklist. Antti, show the checklist for the audience, and they will like a guidebook how they use this method. And now they use this secondary assessment and A, B, C, D, E. And it takes, when we have a heart attack or chest pain in patients, I think about 5 minutes, and then they realize what is wrong or what isn't wrong to the patients. And now they get the ECG, and what is the diagnosis, Antti?
Yeah, I see the changes in ECG that go with the ST elevation infarct in inferior ST elevation infarct. Do you agree?
Yes, I do. I
Yeah.
think we should proceed with this plan.
Yeah.
Okay, and now Jarno and Hannu, we are sitting in the control room. Jarno, would you come here in the control room?
Yes, of course.
Yeah. And we will give details and informations. They will like a blood sugar or something like that, and they will ask what is the patient's blood sugar, what is the patient, because if you take the cardiac pulse, I think it's a 200 right now. Maybe 17 is okay right now. But if I have to take changes, I will told in the control room that the pulse is 150. Then they realized, is there some arrhythmia or something like that? When Jarno and I we record this show or this simulation, and we take notice together and notice in individual instruction, and then we decided that now we have kept the learning goals. We have the learning goals right now, because right now we put it in a hot chest pain patients with ST elevated is it ST elevated infarct. We put it that, and they found that, and now we are getting our learning goals. We don't have to take any more. We don't have to put it guide to the ambulance and etc. We are now getting the learning goals, and now we told that simulation stops, and then we start the debriefing session. Okay, and now you can, Antti, laita sä tuolit ja hakekaa myös pöytä siellä. You have prepared this, and take those corridor over there in the table. when I was in instructor course in 2009, our Peter Riekman was my teacher. Peter is the European Simulation Foundation member and council member also, and he told that when you start the debriefing session, you should make the empty table, and whole thing, what is our learning process and the goals, they are in here, empty table, and now they start to discuss and the process, how the situation goes about the learning goals. We don't have to think about how they take the EGG, what kind of class you go. We don't care, because our learning goals are situation awareness. If they have wrong situation awareness, we notice that they couldn't handle that situation, and whose fault is my fault, because I was prepared to the. I doesn't notice that they are not in that kind of level that they could handle that. But now we realize that everything went just right. We solved, and then they start to discuss and debriefing session is this full-scale simulation main point. When you have to change the internal model, internal model in your brains, they think psychological that this is the
Best way.
Best way, like symbol says. Okay, and normal simulation scenario and debriefing goes three phases. One phase is description phase, about 5 minutes, not analyzed yet, only told they what kind of role, how is the first feeling, and I doesn't notice any smile. I'm a little bit nervous now, but now I know the smile, and now I'm just comfortable when I'm in instructor. Okay, and then analysis phase about 45 minutes. It depends. 30, 45. Someone it takes 1 hour, and the phase 3 is like transfer phase. We have to make sure that circle of learning process is completed. What they have to take home message. Someone says it's a take work message. No one really put it in a home, this kind of system. But I think it's good to say take home message. Okay, Jarno. Now you can start description phase.
Okay, looking at the goals, what went well?
Oh, well, I think our teamwork was okay.
I'm not just jumping by his face, but it's okay.
Yeah.
Okay. And tell me more specific.
Oh, well, I think our teamwork went quite well because we talk to each other, and we had that situation awareness because we used the checklist in the book.
Yeah, I agree to that.
Okay, and now Jarno will stop in ability. You have to ask open questions. Why? If you ask open questions, you get open answers. You open those students, like the Tonnikala book. You open it. Open questions, not dichotomical yes or no, not open questions. Okay, Jarno, continue.
Okay. Could you tell me, was there anything to improve?
Yeah, I think I was a little bit too fast when we were coming to the scene. I was going like you were coming after me, So I should have waited for you so that we would arrive at the same time. Now I was going a little bit too fast, so maybe that.
Yeah, and I could also be a bit faster.
Jarno, make the same questions about our audience, because our audience, what is our learning goal? Do you remember what is our learning goal? Situational awareness. Here's 10 points, students over there. Yeah. Okay, now because you answered the first, you can continue. What do you think about what is the good behavior or what you see according to the learning goals?
From what they're saying here, and so then
Okay, now you said that, and now she wants to do something, and and only what we do in instruction, we just keep the realism. It's okay, and you said that okay. We don't in this phase. We don't say anything. We only ask open questions and open, and everybody could answer. Everybody should and would, because it's a psychological thing. If you say something funny or you say something wrong with another, no one laughs or no one takes, you are comfortable because it's a psychological safe situation. And I noticed that they can handle this. Before I had to know that you all also can handle this. But you always have students who doesn't take homework and like a free ride. And maybe we can discuss later why. Okay. Non-judgmental atmosphere is the key point in this session. Okay, we have another audience in here, and you have to answer what kind of teamwork. What is the good teamwork? What you see? Is there someone who might want to answer? What kind of teamwork? Do we?
No. Many.
Okay. Do you think about? Are you the same field? Okay.
As far as I saw, they were
Now you take the keyboard. You say the word which you think the respect is something, you think that, and you think that. Then we take this digging. Okay, tell me more about what do you feel about respectful.
I went to the patient and they both checked the time.
Okay, now you notice that earlier he said that respect, and now when he really opened it, now we really get what he really thinks. And now even that guy who doesn't make homework, he take part because now he remember also. Okay, and now maybe you also. But this connect whole discussion. Jarno, you can continue.
Okay, Kai, how was the patient experience in this situation?
It was fun. Can I say it was fun?
Okay.
But I felt they approached me in a professional way. They made me feel comfortable. They asked me what was wrong. They listened to my answers. They made eye contact. They both felt my pulse in a respectful way. And were friendly and professional.
Okay, and now Jarno asking open questions also the patient, but we wanted to ask if we wanted to, what is the positive what they do? We have to ask only positive. If I wanted to know what is the what they could do better, then it sounds that lähtökohtaisesti it sounds that yeah, but it's a little bit syyttävä.
It's a bit little bit accusing accused situation.
When you ask it, what they should do different way, and they think about what he gonna say. That when you ask it openly, remember in instruction that you get the open questions. When you ask what is when good and what is when wrong, you get those answers, and you could use that. We use that. Okay, and then we have this middle in here, and this is the instructions part when they hammers in this analysis phase. Jarno, now you could use your hammer.
Okay. Should I say something? Okay. I think also it went very well, as I said earlier. There was good conversation and decision making, yes. But in what did you told me earlier? Just those small moments there you could use or behave a little bit better, a little bit more communication.
Okay, and if we take this part too earlier, no one really students they Jarno hammers it, and he's a realism, and he's like a teacher. But you don't have to hammer it's too early, because it's the end of this analysis phase, and then we have a couple of minutes take home message. What we really want, what we really take home in this, and we ask the patient, and we ask Antti and Veera, and if we have a time, we ask audience also. But if we have this kind of audience,
plenty of students,
we don't really have a time to everyone take home message. It's effective. It's the every time when we use the method, we ask the students. It's very effective, and if you read the studies, they're always read the students' confidence, their own skills grows, and the decision-making process. It's the funny decision-making process. Maybe this is the best way to the practice. This is the decision-making process. If you sit over there and think about decision-making process and try to learn it in there, it might be that this is most effective way to those kind of learning. Critical thinking improves. It's a safety atmosphere. It's a high quality, but even you notice that we don't have cameras, we don't have any equipment. We put it in this. This is a learning. This is much more than technology. You can use it without cameras and etc. And what and why? Feedback from participant. Why? So we can perform better next session. We could prepare better. We know, we are familiar, we know the students' level. Now we know what they really not know in this situation, and then we could put it a little extra in the next simulation. And this is the last sentence is answered in that. Okay, and now our simulation process, we are a little bit late, but still we have plenty of time to get feedback. And in Finland, we take Jarno, this is your part to told.
Is it?
Yeah.
Oh. What did I have to tell?
Miten se päivä jaetaan?
Okay. Could you put the slide?
Yeah,
Help me a little
we
bit.
don't have. But we have 3 teachers, 25 students. We share them 3 parts, 3 different simulations. When the 3 simulation is over right now, we put all the students in a classroom, and then we start the feedback. We have a feedback before preparing phase. We have feedback over there. Jarno and I get the feedback in our control room. We have a feedback right now in Finland in this, and then students go home, then teachers sitting over the table and feedback 5 times every day, every simulation day. We have a feedback because it tells how we have to do it the next time. Okay, now is your time to.
Can I ask, can you predict with this approach how people might behave in a real situation when somebody's really sick and the stress comes on, that, you know, the decision making becomes critical as distinct from learning? What's the connection between the two, let's say?
I think we have a missing data. Is it the effective way? But we have to take the another industries, because we already know that they have human factors are the problem if something went wrong. But what is the healthcare sector? What is the data? We don't have it. We only have to learn other industries and think about it. That it's really are the basics that we have to know how we handle the human factors. And everyday practice, we practice human factor things. This is the decision-making process is quite funny, because always there are situation awareness, individual situation awareness, team situation awareness. They have to take care of also patients with situation awareness whole system. And when you think about SHAREM, you have to gathering all the data, all the knowledge, all the tieto, all the häviää sanat. When
No, yes, yeah, already told.
Thank you for a very deep insight in the realistic simulation of the simulation process. I wanted to ask how many different variations of the simulation you have. Of course, if
it's a good
every student gets to do the heart attack, they might be improved, but maybe surprised then, well, because the pulse is then not on a certain level, or different outcomes come along.
In a paramedic field, it's the best class. What we have, it's a 68 simulation practice. About 10 in hard situation, like arrhythmia, a couple of arrhythmias, then also elvytys, siis tuo CPR and different way, ST elevate, G elevate, and not what simulates a heart attack or chest pain. About, I think, 10 different situations about that kind.
And we have that knowledge, what is relevant, what are the relevant situations we have to practice in the field.
And before that, we have a skill station. It's also the simulation is also skill station. Skill station is also simulation, but what we right now showing you is the full scale simulation method. Okay.
Any other questions? Yes.
Hello, my name is Peter. I got curious. You mentioned pretty much pass through a safe environment for the learning situation. Could you tell me more about how you established that?
We have to prepare. We have to prepare very carefully. We have to prepare when the students come our school. We should start to the lower level and take care that everyone knows that we have to respect each other. We have to act safely. We want that respect. You mentioned that.
Yes. And we also tell them what are human factors. We tell them how to use this method. So there are few key points what we have to tell them. And it's a may I say it's a process. And in the end they have used the simulation method. They have been in simulation about, may I say, 100 times. So individual skills, how to handle that simulation grows in that time, of course.
You asked a very important question, because yes, it's a main point. It has to be psychological safe.
Yeah, because this is very powerful method. We could ruin your confidence easily with this method.
If you do it wrong. Very, it's very good. If they don't succeed, our mistake. We don't succeed. Okay.
I have here one question. Thank you for excellent presentation. And I was wondering, well, I know that in Finland, this simulation pedagogy is used in this kind of healthcare and parametrics and this kind of fields and social work. But do you have some examples from some different disciplinaries? Has it been used in economics or some other totally different field?
I've been teaching in structures course also, and maritime teachers in a couple of years ago. They're using simulation method. We have a pretty new simulators, because it's a different simulator and the simulation method is a big difference. They used technical field, another logistic program. They use the simulation method. I think there's lots of they use, because they have a ONS, that they have so sophisticated simulators also. And what I answer to Eva is that we have so much to do that we make the growth.
Okay. I think we are now running out of the time, but I would like to thank again our presenters and audience, of course, and actors, specialists also. Thank you all.